It's been known for many years, the repeated studies, that if you happen to go into a hospital after hours or on a weekend, your chance of dying from things like heart attack or stroke are much worse. Okay, so you're like, wow. So here we are spending hundreds of millions of dollars to try to reduce mortality, improve well-being, and yet we're being told that one of the causes of preventable mortality is how understaffed we are. We project a 9 to 5, Monday to Friday scheduling system on a body that doesn't know time of day or day of week. We don't have enough talent in healthcare. We are so understaffed. It's apparent that the 21st century is poised to be the healthcare century, and we're probably going to be in a healthcare economy. We have a job glut, we have a demand glut, and we don't have enough people. So just to put some statistics around this, from 2002 to 2012, healthcare jobs grew at a rate of 2.3% compounded annually. That job growth was happening despite automation eliminating so many jobs. There's been a lot of job losses due to technology, innovation, and automation. It's just that the job growth is so vast that the net number has been mushrooming in healthcare. There's just intrinsic growth of demand because the population is aging. Now, we all know population is aging, we've heard that, but we're still underestimating how much of an impact that's having. The current model of healthcare is we help people live longer, but we haven't solved the underlying problem. Therefore, the demand has a feed-forward increase. So that's why healthcare demand has been going geometrically for many, many years. Now, if you look at the Bureau of Labor Statistics estimates going forward, between 2012 and 2022, it is estimated that healthcare as a sector would grow in jobs by 2.6% annualized, compounded, right? So the number of jobs that will have been created between 2002 and 2022 is 8 million jobs, right? That number is commensurate with the total unemployment from 2014. So the job creation out of healthcare could almost obliterate our concerns about unemployment. But we have a huge problem, which is it's very hard to train people to become healthcare professionals. Now, therein lies some very interesting opportunities. Technology is probably going to be the main way by which we bring a lot more trainers onto the system as well as trainees. When you think about why is it so hard for people to train in healthcare, there's some artifacts. First of all, when you look at physicians, which is a small group of the healthcare professionals, it's a guild system, and there's not enough spots. Essentially, you have to be fairly wealthy and be a straight-A student in order to get one of those precious few medical school positions. But let's actually think about what medical school actually is. The first 2 years is all classroom work, and it's the kind of classroom work that can all be put online, where the best teachers of every subject can teach everybody, not just medical students, even the public. The first 2 years can be just like Khan Academy. It can be completely free. It doesn't have to cost $40,000 a year learning from one particular professor. You can learn from the best, and everybody can have access to it. And you can test online, you can take the USMLE. Everybody gets the most up-to-date material all at once. Now, let's think about the last 2 years of medical school and what's called residency, which is post-medical school training. That whole window of time, you pay for it the first 2 years, and you get sub-professional salaries the next 1 to 10 years, is right now seen as a cost to hospitals. So hospitals right now ask for funding from Medicare in order to train these apprentices, right? But is that actually true that it's a cost to the system? Because in many ways, they are inexpensive labor that should scale their business. So the main bottleneck right now for residency spots is considered funding, but we should look at the accounting of that to see if that actually can be addressed better, and maybe they do need more funding. But the second reason why there aren't more residency spots is because there's not enough attendings. In other words, the shortage of doctors is a cause of a shortage of doctors. So it's only by getting a lot more people into the field are we going to solve the bottleneck of there not being enough healthcare professionals. And here's the most magical thing about healthcare as the job engine. So the more people we have in the healthcare economy, in the healthcare industry, helping people live longer and stronger lives, your customers, your patients, become future customers again. The more people we have employed in healthcare, the more jobs it's going to create. Healthcare is the only industry where the job engine actually, in a feed-forward way, creates more jobs for the future.